Welcome, everyone, to tonight's Parent University, brought to you by the Division of Community Engagement and Strategic Partnerships, as well as Student Support Services. My name is Caron Hope. I am a trauma-informed specialist with the Clark County School District, and tonight's Parent University is on trauma and families. This is a pre-recorded presentation, so as you're watching, please be sure to drop your questions or comments in the chat box, and I will be available at the conclusion of the presentation to answer those. Also, please be mindful that this presentation does involve trauma, which can be a very heavy topic for a lot of individuals. So please take care of yourself, step away when you need to, and just do what you have to do to make sure that you take care of yourself. So you might have asked, well, what is a trauma-informed specialist? I've never really heard about that before. Well, it is a new position starting in August of this past year. And essentially what a trauma-informed specialist is someone who develops a framework and then is essentially responsible for the implementation of district-wide trauma-informed practices to create a trauma-informed school district or trauma-informed schools. And what trauma-informed schools are, they're environments that realize the widespread impact of trauma. They recognize the signs and symptoms of trauma. They respond by fully integrating knowledge about trauma into its impact into policies and procedures and practice, such as safety drills or discipline policy. And also it's an environment that does what it can to resist re-traumatization, which isn't possible all the time, but there's always things that can be done to reduce the likelihood that someone could be exposed to trauma stimulus. So essentially the model becomes so thoroughly embedded that it becomes the norm. It just becomes part of the culture. So just to kind of begin with the basics, what is trauma? When I say that word, what does it mean? Because it can mean a lot of different things to different people. So essentially the definition that I like to use is trauma is an event or series of events experienced by a person or a group that overwhelms their ability to cope and results in lasting adverse effects. So there's a little bit of a difference between trauma and stress or extreme stress. And while we'll talk about in a second, trauma can impact people differently, there is somewhat of a continuum. We can experience stress and be affected by it and it not cause long-term lasting effects, whereas trauma is a stressor, something that happens. It overwhelms our ability to cope with it long-term and results in adverse effects. There's also different ways trauma can impact individuals in the community. So there's individual trauma, which is something that happens to one person that overwhelms their ability to cope, such as being bullied, they're in a serious accident, a form of interpersonal violence. Well, there's also collective and community trauma, and that's when an entire group, an entire community experiences trauma as a whole. And one very current relevant example right now is COVID. Our community, our state, our nation, our world has collectively experienced COVID, which I would go so far as to say is traumatic for not only our local community, but the nation as a whole. It's also generational trauma, which is trauma that has happened in the past where the effects of it kind of get passed down to generation, and talk a little bit more later on about what that means. And then organizational trauma. Organizations can absolutely experience trauma, whether it's a school district, whether it's a corporation. Organizations can experience trauma just like people do, and maybe develop some not so healthy or great ways to cope with that can be adverse to their organization and to the people in the organization. And then as you can see below, just some examples of different types of trauma that people, communities, generations, organizations can experience. School violence, not only acts of school violence themselves, but the after effects of it. So kids having to do safety drills, even though something might not have happened at their school, they see it on TV and they go to school and they're afraid. Bullying, terrorism, abuse, violence within the family, homelessness, poverty, racism, fire, serious illness. All of these things are examples that can be traumatic to individuals or communities. So this is a diagram that talks about different types of adverse childhood experiences or adverse community experiences. So there was a study that was completed years ago called the ACE study, Adverse Childhood Experiences. So it was a collaboration between CDC and Kaiser Permanente, and they developed a list of adverse childhood experiences that primarily centered around things that may happen to a child in a household. And they looked at adverse effects of that later on in life. So for example, the findings ended up being the more adverse childhood experiences someone had, the more health problems they might have had later in life, the more likely they were to have experienced poverty, or substance misuse, suicide. So they made, and it was a large study. It was, I believe, over like 60,000 participants, and they've expanded on it as well as other entities have expanded on it to include more adverse experiences. So it was really the first time that on paper it was shown that trauma is a public health issue, potentially a public health crisis in a lot of communities. So this particular diagram that expands upon the original adverse childhood experiences which were, does a child have a parent who is incarcerated? Does a child have a parent who misuses substances? Is the child themselves experiencing some type of physical or sexual abuse? Is there domestic violence going on in the home? So all of those were original ACEs, and it did not really include the whole socio-ecological picture of, well, what's going on in the community? What has happened historically? What about natural disasters? That there are a lot of things that can happen that result in trauma that can be connected to adverse experiences later on in life. So you can just kind of take a few minutes to look at this. The first one is kind of identified as household. So this is more in the same vein of the original ACE study, where, is there domestic violence in the home? Is there a parent who has a mental health issue? Are divorced, incarceration? Those things can occur to someone within a household. And then the roots of the tree, which are more community oriented or systemic, where there's poverty, where there's no living wages, a lack of jobs, violence, racism, food insecurity. And then the environment over to the right, things that happen that are really beyond anyone's control: pandemic, earthquakes, natural disasters. So you might have looked at those adverse childhood experiences or those adverse community experiences and recognized that those things may happen to everyone. If an earthquake happens in a community, everyone experiences that earthquake. If you have a family where there's violence in the home, that happens to everyone. They may react differently. So why is that? Why does if multiple people experience one event, why does it affect them in different ways? And what that really comes down to is the definition of trauma. So if you look at the 3 E's of trauma, there's the event that happens. So that's the event or the circumstances that led to the threat or actual physical harm, psychological harm that overwhelmed a person's ability to cope. So there's this thing or this multiple set of things that happened. The trauma comes from the experience of that. So the sexual assault, for example, isn't the trauma. It's the person's who it happened to, their perception of the event or their reaction to the event. So what that basically means is what's traumatic for one person may not be to another. And so when you're talking about trauma-informed practices, that's really important for everyone to have an understanding and not try to, one, minimize something that happened to someone that is in fact traumatic to them, but also put trauma on someone who it might not be that for them. There's a lot of things that may happen that I, for example, or some of you watching would be like, wow, if that happened to me, I would be so traumatized. Whereas the person it actually happened to, for whatever protective factors they might have in their life, it wasn't for them. So it's just really important to recognize the individualized aspect of what may or may not be traumatic for someone, that it's their experience, it's their perception of the event, that what makes it traumatic for them, not the event itself. And then, of course, long-lasting effects. So are there long-lasting adverse effects which would make this actual trauma? And then you could get into the realm of post-traumatic stress disorder, which, not everyone who experiences trauma or is traumatized by something develops post-traumatic stress disorder. It just depends on a whole wide variety of things and risk and protective factors that I'll get into a little bit later. So moving into trauma stimuli or trauma triggers. So we talked about the 3 E's of trauma. We talked about events, adverse experiences that may be traumatic for individuals. So why is it that individuals might have trauma responses or re-experience the traumatic events long after they happen? And so that's where trauma stimuli, or a more common term, are triggers. I try to stay away from that word sometimes, just because I think it's become overused, and it's become a word that may minimize some of the trauma responses or trauma stimuli that exist. So trauma stimuli or a trigger is some aspect or memory of a traumatic event that occurs in a completely different situation, but reminds the person of the original event. And when that happens, I think we'll get to in the next slide or two, there are things that happen in the brain and in the body in a means of trying to protect that person that causes a trauma response. So common things are sounds, smells, feelings, places, tones of voice that can remind someone of a traumatic experience and bring them back to that time. And then their body reacts as though they're there, and the responses might kick in. The trigger could be very clear, such as testifying in court or an anniversary of an event, which are pretty, if someone has a trauma response and they just testified in court, or they just experienced the anniversary of a death of a loved one, and they have a trauma response, there's a pretty clear connection there. Sometimes it's a little more subtle and hard to identify, and that's where your senses kind of come in. So smell and sounds are very huge when it comes to trauma responses, but then they can also be very hard to connect those two things together. And then kids and teens, or anyone really with trauma histories, may have developed coping skills in response to triggers in an effort to feel safe, and those can conflict with behavioral norms. And so again, that's where trauma-informed practices in schools can be very important, because we do have kids and teens in our schools who have experienced trauma, and the school environment isn't always conducive for feeling safe. And so they may have trauma responses that are running out of the classroom, or being, disruptive and arguing, when in fact it's a trauma response. And that doesn't mean that they shouldn't be held accountable in some way if their behaviors are disruptive to the learning or unsafe to everyone else. However, it's going to look a little different. It just needs more than traditional discipline. And so that's really where trauma-informed practices can be very important in the classroom, in recognizing a trauma response versus something that's purely behavioral. So going back to trauma responses, why do they happen? Like what makes someone react to something related to an event that may have happened weeks, months, years ago? So that really comes down to what happens in the brain. It happens to how our brain is made up and what goes on when we feel fear. So essentially, there are 3 main parts of the brain. There's the survival part of the brain, which is the brain stem. It develops first. And then there's the emotional part of the brain, or the mammalian brain, that is responsible for keeping memories. It's responsible for our emotions. It develops second. And then there's the frontal lobe of the brain, which is logical thought, critical thinking, reasoning, and it develops last. And the reason that this is important is when someone experiences trauma, it affects their brain development. And so when we have children and adolescents whose brains are developing and they experience trauma, it can stunt that growth. And so the survival or the reptilian brain plays more of a part with individuals who have experienced trauma than the emotional brain or the logical thinking part of the brain. So we call this the bottom-up approach to trauma. Someone has experienced trauma. When someone feels fear, the survival brain takes over. Logical thought shuts down, emotion brain shuts down, and it just becomes, what do I have to do to survive this? What do I have to do to survive this situation? And it's typically the 4 F's. Body kind of decides for you, am I going to stay and fight? Am I going to run away? Body might decide you need to freeze, or you might fawn, which kind of means zoning out or not really reacting in any kind of way. Fawn and freeze are very similar in terms of trauma responses. And so again, with trauma-informed practices, this is very important, because sometimes these trauma responses, or not even sometimes, these trauma responses are automatic for someone who has not had any intervention in terms of managing their trauma or had treatment for their trauma. These responses are automatic. So again, when we have kids who have experienced trauma, they've developed these coping skills to feel safe because their brains have decided for them what should happen, and it can kind of overtake what their body does. So for example, you have a student in the classroom and they experience a stimulus or a trigger in some way. Maybe two people are fighting in the classroom, or maybe the teacher raises their voice and it reminds that kid of a time his parents or her parents or their parents were fighting at home. The survival part of the brain takes over. It was like, oh, we've been here before. What do we do? And then it can either be a fight response, which could be an anger outburst. That is sometimes seen with students as unruly behavior or disorderly conduct, when in fact, that person is like, no, this is a situation I need to survive, and they don't really have control over it in the moment. Or the person may flee. Flight, elopement is something that is considered a disciplinary issue in school. So if you have if there's a student or a child that runs out of their classroom or runs out of the lunchroom, what happened right before that? Was there a preceding event that might have been a stimulus for that person? And can we go back and look at reducing what that stimulus might be? And then there's freeze and fawn. And these are really the two responses that kids or teens, students might experience that I think can be overlooked as a trauma response. So trauma-informed practices aren't always related to discipline. Obviously, trauma-informed practices are a huge part of the disciplinary process. And then when you're using more progressive disciplinary processes like restorative practices, you would use trauma-informed practices in that. So they are very entwined, but they can be different things. The trauma responses that involve freeze or fawn typically aren't behavior problems. It might be the person sitting in the back of the classroom that's very quiet, or on the playground that's off to themselves, or the person who zones out when they're trying to take a test. Those all can be trauma responses that aren't necessarily seen as behavioral problems and can be overlooked, but it might also mean that that's their coping skill for whatever they might be responding to. So just take a look at some of these definitions or descriptions of these responses, and think about labels we might put on kids, whether at school or even at home as parents, as caregivers. What labels we might put on students that or kids that may be mislabeled. And these are how behaviors might present. So if thinking back to the 4 F's or the trauma responses, and then when you're looking at specific behaviors, so just to, again, take a look at these and see, what might be present in students or, in individuals within our own families, and how it could cause someone, a student, to be mislabeled. So some examples in terms of developmentally, if you're looking at preschool age, of course, preschool kids aren't necessarily going to be able to sit down and tell you what's going on with them or what they're feeling. So they might have nightmares. They might cry a lot. They might have recreate the trauma through play. So that's why with preschool age and elementary school age children, therapy like play therapy is really important, because kids, anyone really, have a hard time sitting down and expressing and articulating what happened to them and how they're feeling about it. Whereas through play or art, it might be a little easier for that child to do so. Elementary school children may become more anxious or fearful. They might worry about others a lot, have a hard time concentrating, difficulty sleeping, changes in school performance. Those are kind of similar to what you get into middle school and high school, or middle school and high school age. If there are trauma histories, it could potentially lead to more risk taking, in addition to depression or anxiety, maybe feeling like they're kind of losing their, going crazy, so to speak, using their words. Don't want to go to places that remind them of the event. They might withdraw from their friends. They might also become more sexually active or engage in more risky behaviors like drug and alcohol misuse. So again, these things are not always, just because someone might be experiencing one or more of these things does not absolutely mean they've experienced trauma, but this is definitely how trauma can present, especially in our kids and adolescents. And so knowing that if none of these things exist and then one day they just show up, then that might be something to consider, in terms of if they're going to see a therapist, or if they're in a meeting with their school counselor, if sudden changes in behavior can be really indicative that something happened that they're responding to. So I mentioned before, with trauma, we can have multiple people who experience the same exact event, and then it affects them differently. And that can come down in a lot of ways to risk and protective factors. So there's a lot of risk and protective factors rather, that are internal and external, as well as risk factors. So risk factors are things that might make it harder for an individual to overcome trauma, whereas protective factors, given the word protective factors, would be things that exist that might make it more likely that they're going to overcome or be able to manage their trauma a little bit better. So we've got the severity of the event. While trauma is different for everyone, there are a continuum of events that could occur where, not to compare what's bad or what's worse, but if we're talking about serious injury, if we're talking about the death of a loved one or a violent assault, those things may fall over here into a school shooting in terms of severity of the event. So that definitely plays a part in recovery. It also can matter when we're talking about things that happen in terms of interpersonal violence. So if there's physical violence, dating violence, for example, sexual assault, emotional or psychological abuse, if those things are perpetrated by someone the individual knows, that's a huge risk factor, rather than they just had harm caused to them by a stranger because of the betrayal piece. Not that it's not difficult if harm is perpetrated to someone by a stranger. It's almost, in just my work in trauma therapy, it's almost easier for them to rationalize a stranger causing harm because, oh, they didn't know me, they're just a bad person, that's who they are, versus someone they may have been in a relationship with, a family member, someone they trusted. Whereas if that person perpetuates harm, it's much harder to rationalize. And so it therefore is easier for them to internalize feelings of, well, it must have been my fault. It must have been something I've done. I can't trust anyone. I thought I trusted this person and I don't, and so now I can't trust anyone. So that betrayal piece, again, that's a huge risk factor if the person who perpetuated the harm is someone that they know. The proximity to the event. Did this event happen yesterday? Did it happen 2 months ago? Did it happen last year? And that really, trauma can be delayed because our bodies have a way of protecting and hiding things in our brains. And so memories can sometimes just pop up where we didn't remember a detail when it happened, but 3 months later, we have a certain smell or hear a voice, and then a memory kind of comes back to us. However, you're talking about acute symptoms, something happened yesterday or a week ago, there's just less time to process than if it happened 3 years ago. But more of that protective factor is, what has an individual who experienced that trauma, what have they, what have they worked on? Have they seen a therapist? Have they talked about it in a support group? Those types of things tend to matter more than just the time in between. Caregivers' reactions. So if we're talking about someone who has experienced, some form of trauma, whether it's severe bullying at school, whether it's some type of child molestation or sexual abuse, the initial disclosure can be a risk or a protective factor. So if, as a parent or a caregiver, your response to that initial disclosure is, and this is what the research tells us, almost more important to that child or that adolescent's recovery than the event itself. Because remember, we talked about there's an event that happens, and then the trauma comes from the perception or the experience of that event. So if something terrible happens to someone, something traumatic, and they tell a person they trust, and that person doesn't believe them, if they minimize it, if they kind of brush it off or try to sweep it under the rug, that's going to mean a lot more to that person who experienced that trauma than the event itself, because it's going to reinforce those feelings of, this must have been my fault, it must have been something I've done, I trusted this person and they don't believe me, so I'm not going to tell anyone else because they're not going to believe me either. So that initial reaction and that initial, especially if it's initial disclosure, if you're being told this by your child for the first time, that reaction is very key to their ability to cope. Prior history of trauma, also called compound trauma. If someone experiences trauma over and over and over again, going back to how trauma affects the brain, then there are times that the more someone experiences trauma, their brains just become automatically in survival mode, which means they're always hypervigilant, where they're kind of constantly looking around, seeing, what's behind them, or where they're feeling depressed all of the time, or any of those, they're always having flashbacks or re-experiencing, because they've experienced trauma so much, their body thinks that state of feeling is normal. Like, this is what we're supposed to feel like, which of course makes it harder to cope with. And then family and community factors. In terms of family resiliency, of community resiliency, are there resources in the community, which we know here is a huge issue in terms of counseling and therapy in general, but talking about trauma-specific therapy, it can be very hard to find a good therapist, especially one that specializes in children and adolescents. And then family resiliency. Is there a history of trauma within the family to where the family unit has a trauma responses? And we'll talk about that in a few minutes. So the impact of trauma within families. This can be when someone experiences trauma, it can impact the whole family in a variety of ways. So families can either experience collective trauma in that one event happened to all of them, car accident, for example, the death of a loved one, of an immediate or a very close family member, or there could be one person experiencing trauma and then that impacts the whole family. And then families as a unit can experience trauma much like an individual can. And then families develop coping skills in an attempt to protect their unit as a family that are unhealthy. And that could look like poor communication with one another. It could look like poor boundaries with one another or with other people. It could look like withdrawing because as a unit, they don't feel safe and they kind of become codependent on one another. And so they really don't want anyone else around them. And so they kind of withdraw into themselves as a family unit. And then there's secondary stress and vicarious trauma that family members can experience. So for example, something happens to a child in a family that's maybe the youngest, and the dynamic of the family has been an older child looking out for that younger child. That older child could take on a lot of guilt and feel like, okay, this is my fault. I'm supposed to protect my little brother and he got hurt. So this is my fault. And then they experience that secondary stress or that vicarious trauma through a family member. And then historical, generational, or inherited trauma. This is when the effects of trauma experienced by prior generations are passed down to the next generation. And this can look a lot of different ways. So in terms of historical trauma is more when a group has had harm done to their group in the past. So for example, the Holocaust. And so knowing that happened to your ancestors, knowing that might have happened to a great-great-grandparent or something along those lines, could feel the feelings around that in more terms of kind of vicarious historical trauma, that these horrible things happened to my ancestors just because they were a part of a group of people. There's generational trauma or intergenerational trauma, which is more experiencing trauma from the effects of trauma that may have happened in past generations. So again, going back to the Holocaust or slavery or genocide, when those things happen, there's a loss within that generation. They lose opportunities. They lose the ability to do things that might better the future generations. And so then those future generations don't have the opportunities, the wealth, the things that they lost in prior generations, which can contribute to trauma. And then inherited trauma. This is something that there is some research on, does trauma get passed down physically in DNA? Does it get actually physically passed down in bodies through DNA? So moving on to trauma-informed caregiving, we've kind of talked about basic principles of trauma-informed practices, and trauma-informed caregiving is very similar. It's creating an environment that is safe for everyone, really, whether or not, if your own children, or especially if we have any foster parents who are on the session this evening, where you may not know what the children or the teens or adolescents have experienced that you might be taking into your home. And of course, it's not necessarily appropriate as a stranger or someone they've never met before to ask, because that could potentially cause harm. So just creating an environment as if, not that you assume they've experienced trauma, but what if they did? And I don't know about it. I just want to make my home, my environment, the safe as I possibly can. So again, a trauma-informed caregiver understands the impact of trauma. They recognize the signs and symptoms of trauma, and they respond in a way that supports the child and limits potential for re-traumatization. So for example, if there's a child who's experienced sexual abuse, maybe that child needs a room by themselves, or they need a space that's just their own. But above all else, be aware of, as a parent, as a caregiver, of your own stress and how your own history of trauma, if it exists, if it's present, may impact your interactions with your child or with your teen. Because if we have our own kind of unrecognized trauma, it might make it very difficult for us to support our kids and our adolescents who've experienced trauma themselves. So as a trauma-informed caregiver, learn to notice and avoid or lessen triggers or trauma stimulus. It's not possible, and it's not possible to get rid of everything because we don't always know what could stimulate someone's trauma response or what could trigger someone. But there are some things that may be apparent that you could remove or at the very least limit or lessen. So find out what distracts or makes your child anxious, work to lessen these things. And just notice what they are, help your child avoid them if possible, and if not, mitigate the risk that might come from that. So whether it's loud noises, certain smells, certain sounds, whether they're loud or not. So just try to keep track of if you have a child who has a trauma response. Okay, well, what happened right before it? What was going on? Setting up routines for the day, for meals, for bedtime, so they know what to expect. In terms of trauma-informed practices at schools, this one is huge, setting expectations. And as long as individuals know what to expect and the process of what's going on and the why is explained, it's going to lessen the blow. For example, I have worked extensively with survivors or victims of interpersonal violence. And so I've sat in on a lot of law enforcement interviews. And one of the suggestions that I would give to the detectives or whoever was conducting the interviews, that you need to explain why you're asking the questions that you're asking. Because if you don't, and it's intent versus impact. If it's taken a certain way, then you've shut down that person and they're not going to answer you anymore. Whereas if you explain, hey, I'm asking you this question about what you were wearing that night because I need to be able to find you on the surveillance video downtown, then that's going to be like, oh, well, that makes sense, versus just asking what someone was wearing. They're going to take that as, oh, you're blaming me for this, and it's just going to shut down. So just explain what you're doing and why you're doing it, just so that individuals know what to expect, kids know what to expect. Giving your child a sense of control through simple choices. Respect your child's decisions, pick your battles. I'm a parent. I have a 10-year-old and a 7-year-old, and this is hard for me. It's, far beyond the you're going to do this because you're going to say you're going to do this, but whether it's so much easier to give simple choices. You can choose this or you can choose this. Both are safe, acceptable choices. Doesn't matter to me as a parent which one is chosen, but it gives that child a sense of autonomy and a sense of choice. And especially with kids who have experienced trauma, they've lost a lot of control. They had choices taken away from them. And so any opportunity to give a individual who's been traumatized back choice and control, take it, because it's going to go a very long way in their recovery. Again, as long as the choice is negotiable. So it's something that's going to cause harm to the child. If it's something that's not safe, then explaining why that thing might not be safe can go a long way. And then don't take your child's behavior personally. Behavior is a form of communication. Again, as a parent, my 10-year-old is a girl, and I've realized that we are very similar personalities. And so we can get into a lot of power struggles. And then sometimes I get my feelings hurt, and it's a form of communication on her part that has nothing to do with me. She's trying to express a need and might do it in a way that is hurtful or not as respectful as I would like it to be. But then we work on that and most of the time can come up with an acceptable outcome. Letting your child feel the way that they feel. Teach your child words to describe their feelings when they are calm, when they can use when they get upset. This either verbally or through art. If you have if your child or your teen is upset and they aren't able to express it to you verbally, maybe have them write in a journal. If it's an older adolescent or teenager, draw a picture, write a story, any way that they can express themselves and how they're feeling, and then teach them that going forward how they can name what they're feeling. Be consistent, predictable, caring, and patient. This shows your child that you can be trusted. And then remaining available and responsive, even if your child keeps you at a distance. If we have children and teens and adolescents who've experienced trauma, they might have a hard time forming and maintaining relationships, even if it's a parent, even if it's a caregiver, and they might want their space sometimes. And so letting them know you're available, you're there to support and help them, and also giving them their space when they need it, as long as it's safe to do so. And then asking for help. These strategies aren't really, they're not always easy for everyone, but if you're, as a parent, as a caregiver, if you're having difficulty managing your stress yourself, or you have a trauma history yourself, some of these things can be difficult. So reaching out, I have some resources at the end of this session, maybe reaching out to some individuals who specialize in family work, and getting some help in implementing some of these things at home. So holidays, we're coming up on the winter break that's over 2 weeks long. And so that is, while it's welcome for a lot of people, it might not be for others. And then it could be a mixed bag for others. Some individuals might look forward to it, at the same time have some anxiety or some dread around what winter break might mean. So obviously it means there's a change in routine. So we go from kids and teens to being in school 5 days a week from 7:30 to 3:30 or later, to being home all day, every day. And that's stressful. It's stressful as a kid, as a teen. It's stressful as a parent or a caregiver. And so whenever there are changes in routine, that can exacerbate trauma responses. If you go from a schedule that's structured, that you're used to something that's not as structured, it can mean uncertainty, and that can bring on trauma responses. So I'm not suggesting that your winter break should be structured every minute of every day, but just knowing what works for you and what works for your family, and trying to have something every day, even if it's just something at home that doesn't require you to leave the house or it doesn't cost any money. If whether it's a card game or something you can do together as a family, and kind of have it planned out and stick to that, it can kind of go a long way in kids. Like, okay, well, this is going to happen tomorrow, and then this is going to happen on Wednesday, and it can just kind of help with that reduction of stress related to the change in routine. Holidays can heighten feelings of grief and loss. If part of the trauma experienced is losing a loved one, holidays can be very, very hard. And so recognizing that, naming it, first of all, that, okay, well, this Christmas without grandma is going to be a lot different than last Christmas. And so what can we do to honor her? What can we do, and just kind of being kind to yourself and knowing that those feelings exist and that it might be different, and that's okay. Kids and teens also might have some grief and loss, especially, as I mentioned, if in terms of foster children, if any of you all are foster parents, there might be some grief and loss. Maybe they had Christmas last year with their family. Maybe they spent Hanukkah last year with their family, and then they were removed from that home, and grieving that time with their family. And so that can be a huge trauma stimulus for those individuals. The sensory overload of winter break, if you're busy, if you're traveling a lot, if you're going to see Christmas lights, and if you're going to see Santa Claus, or if you're going to do whatever you do over the holidays, that can be a lot. It can be a lot of sensory overload. So just, reminding yourself to take breaks and to slow down and take care of yourselves as family when you need it. If you have something planned, the family decides, you know what, I don't really want to do that. I don't have the energy for it. It's okay to say no. It's okay to say no. We're not gonna do that this time. We need to stay home and recharge and take care of ourselves. There's an increase in potential triggers or stimulus, especially if you're seeing family. Might be a lot of family kids don't see often, and so there's a lot of, oh, go hug Uncle Joe or go hug cousin so and so. And that can be uncomfortable for kids or teens who've experienced trauma. And so just kind of making it clear that you don't have to do that. You don't have to, if someone's making you uncomfortable, or even if they're not making you uncomfortable, if you don't want to go hug this person who you don't know very well, who you haven't seen in 2 years, you don't have to. You can say hi from a distance. If that physical touch is going to make you feel uncomfortable. So there's just an increase of things like that could be potential triggers or stimulus for kids' routines. And then just kind of going back to being together all the time. Stress levels are high. I know, again, going back to me as a mom, my 2 kids, when they spend some time together, when they're at school all day, in the evenings, they typically get along. They get along just fine. Winter break, Thanksgiving, when they've had together time, that's when it gets a little Thunderdome, and we have to step in and regulate it a little bit. Just because they're spending so much time together, they get tired of each other, and so then they react as such. And then parents and caregivers are likely to feel increased stress over the holidays, and that can impact relationships. So if you're feeling stressed already, and you're here in terms of what you're able to deal with or what you're able to cope with, and then your kids start fighting, or something happens, it's going to be a lot harder for you to deal and cope with it than if your stress level was lower. So just think about ways over winter break that you can have time for yourselves as parents or caregivers to recharge your batteries, trying to keep your stress levels lower, because the more centered we are, the easier it is to kind of manage and work with our kids and our teens. So in terms of resources, there is Georgia Crisis and Access Line. So that is a statewide number that it's not only a crisis line that someone can call if they're feeling suicidal or like they want to hurt themselves. It's also an access line to services in the state of Georgia. So say you're just looking for alcohol and drug treatment for your teenager, for example, or you want an adolescent therapist or a child therapist, for example, you can call this line and they can help you locate someone who may be able to do that. Again, in all transparency, resources, particularly mental health resources, psychiatric resources in the greater Athens, Clarke County area right now are scarce. Because of what we've all collectively as a community have experienced over the last 2 years, our therapists are full. They have wait lists, and so it can be difficult. And so this is where your school counselors are important, your school social workers, your behavior interventionists, your behavior specialists, because they are in the know of what may exist in the community to help should it be needed. So, knowing who they are, reaching out to them if you need it, that's why they're there, and they're happy to assist you in any way that they can. The Cottage is wonderful. They are the sexual assault and child abuse resource center here in Athens. They serve Athens, Clarke County, and multiple other counties, and they are wonderful. They have support groups for kids and parents, any child who's experienced sexual abuse, or child or adolescents who've experienced sexual assault. Like they have support groups and counseling available for individuals. That number there is the 24-hour hotline, so you can reach someone on that line 24 hours a day. Project Safe is our local domestic violence shelter. So any families who might be experiencing domestic violence, they have resources. They have a crisis shelter. So if safety is an issue and individuals from a family need to get away from someone who might be perpetrating harm, then they can contact Project Safe to go for emergency housing. And they also have other resources. They have legal advocates that can help with temporary protective orders. They have support groups. They just have a wide variety of resources available. Again, that's a 24-hour hotline. And then there's also a teen text line, which is a way that teens, if they're experiencing dating violence in their relationships, they can text with a trained advocate for support, for resources. It's just a great way, knowing that our younger generation doesn't like to necessarily pick up the phone and call anyone. They can still get help through Project Safe by texting. Advantage Behavioral Health Systems, it's our community mental health provider. They have a child and adolescent unit off of Mitchell Bridge Road. They just have a lot of programs available for individuals who have Medicaid or are uninsured. Those are their two numbers there for services. And then again, I can't stress enough your school-based support in terms of your school counselors or your school social workers. If you don't know who those people are in your child's school, suggest that you find out who they are, just so that if you need to reach out to them, you can, because again, that's what they're there for. So we have now moved on to our Q&A session. So I hope throughout the presentation that you have dropped any questions or any comments you might have in the chat. I will be available to answer those for you. This is my contact information. So again, my name is Caron Hope. My pronouns are she, her, and hers. The trauma-informed specialist at the Clark County School District. I'm located within the Department of Student Support Services. My email address is there on the screen as well. So feel free, if there's any questions, maybe you don't feel comfortable dropping in the chat box or you think of one later and you want to ask me, just send me an email. I'll be happy to answer whatever it is by email, or if we need to set up a quick phone call, I can do that as well. So I thank you all for joining us in this Parent University presentation this afternoon, and I look forward to engaging in more dialogue with you all via the chat box. I hope you all have a good evening. Thank you.